There's a very small moment I see all the time in patients over 60. Not when they come in with a serious diagnosis, not when they're holding a worrying test result. It's the moment they stand up from a familiar chair and suddenly pause for just a second. They're still smiling, still talking like everything is normal. But in their eyes, I can see the question clearly. Wait, why did standing up feel harder today? Many people brush it off as simple fatigue. Others quietly reassure themselves, it's probably just age, and then they move on. But after more than 25 years of working with older adults, I can tell you this honestly. Independence is not lost in one day. It fades through small moments just like this. After 50, 60, even 70, what changes isn't just weaker muscles, it's that. Your legs react a little slower. Your joints don't trust load the way they used to. Your brain and muscles don't communicate as clearly. And when those three things happen together, all it takes is a small misstep, a low curb, a quick turn to cause a fall that can change everything. What concerns me most isn't the number of falls. It's the belief so many people carry with them. After this age, weakness is normal. Why bother fighting it? No, that is not the truth. My name is David Warren. I'm an internal medicine physician, and I'm 60 years old myself. I've spent most of my career helping people over 50 stay able to stand, walk, and live independently for as long as possible. And if there's one thing I've learned very clearly, it's this. The human body doesn't give up because of age. It gives up when we stop sending it the right signals. In today's video, I'm not talking about heavy workouts. I'm not talking about running. And I'm not talking about exercises that make you afraid of joint pain or injury. We're going to talk about the right movement principles for the body after 60. Principles that help. Your legs grow stronger safely, your joints feel more stable, your balance improve. And most importantly, help you regain confidence when you move. If you feel like standing up is getting harder, get tired quickly when climbing stairs, still walk every day, but secretly worry about tripping or simply don't want to become dependent on others, then this video was made for you. Point 1. After 60, the problem isn't weakness, it's that the body loses the right signal. After 50, the body starts changing in a very specific way. Muscle doesn't disappear overnight, but the nervous system, the system that tells muscles what to do, starts sending signals that are slower and weaker. Simply put, your brain still wants to stand up, but the signal reaches your legs a bit late, and the muscles don't respond with enough force. That's why so many people tell me, "Doctor, I walk just fine. Why does standing up feel weak?" The problem isn't motivation, and it's not really age. The problem is that the body is no longer receiving the kind of signal it needs to maintain strength. When brain-muscle communication weakens, you start to notice. You need momentum to stand up. The first step is always the hardest. Turning your body feels less confident. You start avoiding movements that feel challenging, and that avoidance quietly makes the body weaker, even if you're not lazy at all. After 60, the body doesn't need more movement. It needs better movement, intentional movement, slow, controlled motion, holding muscles active long enough for the brain to relearn. I often tell my patients, muscles don't need to be woken up by force. They need to be woken up by attention. When you hold a stable position, clearly feel the muscles working, move without rushing or holding your breath, you send a powerful message back to the brain. This body still needs strength. At 60, I don't train to prove I'm still young. I train so that every morning, I stand up without thinking, I walk without worrying, and I know my body still listens to me. If you remember just one thing from this section, remember this. After 60, the body isn't weak because of age. It's weak because we stop communicating clearly with it. Point 2. Walking is good, but it's not enough to keep you steady when it matters. Many patients say to me proudly, "Don't worry, doctor, I walk every day." And they're right. Walking is excellent for the heart, lungs, circulation, and mood. But physiologically, walking is a movement that is repetitive, rhythmic, predictable, and low in reaction demand. After 60, the biggest issue isn't how far you can walk. It's, can you stand up in time when you lose balance? Can your joints stay stable during a sudden turn? Can you react fast enough when you trip slightly? Those abilities are not trained well by walking alone. That's why I see so many people who walk 20, 30 minutes every day, have decent heart health, but still struggle with standing up from low chairs, fatigue on stairs, fear in crowded places. They're not lazy. They're just training the wrong priority. After 60, movement needs three things that walking lacks: load holding, teaching muscles to support weight without moving; joint stability, teaching knees, hips, and ankles to stay steady; controlled slow to fast transitions, reconnecting the brain and muscles. Walking should stay, but it should be your foundation, not your entire solution. I often tell my patients, walking helps you live longer, but the right kind of leg strength helps you live independently longer. If you only have 20 minutes a day, split it. 10 minutes walking, 10 minutes controlled, stability-focused movement. That second part is what keeps you steady, keeps you confident, and keeps you from fearing an unexpected fall. Point 3, joints don't need to be avoided. They need to be taught how to bear loads safely. After 60, many people start living by an unspoken rule. Avoid anything that puts weight on the joints. It sounds logical, but biologically, joints are nourished by controlled movement. Joint cartilage has no direct blood supply. It gets nutrition through gentle pressure, release, repetition. When you completely avoid load, the muscles around the joint weaken, the joint becomes less stable. The brain starts to fear weight-bearing positions, and a paradox appears. The more you fear joint pain, the more fragile the joint becomes. People who avoid load often experience loose knees, shaky standing, anxiety when sitting down or standing up. Meanwhile, those taught to load joints correctly often report less pain, more confidence, and surprised at how cooperative their joints become. After 60, the body doesn't need impact, but it desperately needs static load. Feet grounded, joints in neutral positions, muscles working continuously, no bouncing, no rushing. I call this teaching your joints to trust themselves again. When joints relearn this, the brain reduces danger signals, allows more natural movement, releases unnecessary tension. I always tell my patients, joints don't hate movement. They hate uncontrolled movement. If you've ever feared standing too long, avoided sitting low, worried about your knees clicking, remember this: your joints are not weak. They've just lost confidence, and confidence can be rebuilt slowly, safely, one day at a time. Point 4, balance doesn't come from being stronger. It comes from reacting in time. When people talk about falls, most immediately think it's probably because the legs are weak. In reality, weakness is only part of the story. The other part, and the one most often overlooked, is reaction speed in the nervous system. After 60, the brain processes signals a little slower. Nerves send messages to the legs a fraction later. Muscles respond just a bit too late. And sometimes being late by half a second is all it takes for the body to fail to correct itself. When you lightly trip, your weight shifts off center. You turn suddenly. Most falls don't happen because of a lack of strength. They happen because the body runs out of reaction time. When balance reflexes decline, you may notice fear of crowded places, fear of slippery floors, fear of walking at night, constantly looking down at your feet while walking, and that leads to slower walking, a hunched posture, even greater instability. On the other hand, when balance reflexes improve, your steps feel more natural, your gaze lifts forward, your body starts to keep up with itself again. To improve balance after 60, the body needs slightly unstable situations. High focus, enough time for the brain to relearn. There's no need for danger, no need for risk, just shifting weight onto one side, waking up the small stabilizing muscles around the ankles, knees, and hips, teaching the brain to constantly adjust. I often explain it like this: balance is like conversation. If you don't use it regularly, you start speaking slowly and hesitantly. I always encourage patients to train balance while they still feel safe, not after they've already fallen. If you can still stand, can still walk, can still take care of yourself, This is the golden window to train your reflexes. Balance doesn't disappear because of age. It disappears because we stop practicing it. Point 5. Poor leg circulation is the hidden bottleneck that makes you tired, shaky, and less confident. Very few people over 60 are told this clearly. Your legs aren't just for standing and walking. They're part of your circulation system. The muscles in the lower legs, especially the calves, act like a secondary pump. When they contract, they push blood back toward the heart. When they relax, fresh blood flows back down. After 60, if these muscles weaken, blood return slows. Legs feel heavy or mildly swollen. Fatigue and shakiness appear sooner. The brain then receives a warning signal. This leg isn't stable. Be careful. And that's where confidence begins to fade. When leg circulation is poor, you may notice getting tired after a short walk, feeling shaky when standing for a while, heavier legs in the afternoon than the morning, rapid fatigue when climbing stairs. But when circulation improves, legs feel lighter, steps feel steadier. You need fewer rest breaks, and most importantly, you're less afraid of losing balance. After 60, the body doesn't need running to pump blood. It needs controlled contraction and release, a slow rhythm, consistent repetition. When you move the ankles through a full range, clearly feel the calf muscles working. Avoid rushing or holding your breath. You help. Blood return to the heart more easily. The brain feels safer. Your legs become more trustworthy with each step. I often tell my patients, if your legs feel tired often, don't assume it's weakness. Sometimes it's simply that the blood hasn't made it back yet. At 60, I pay close attention to how my legs feel. Light or heavy, warm or cold, steady or shaky. Because those sensations are early signals, telling us whether the body feels confident or is sending a warning. Well-nourished legs don't just become stronger, they give you the courage to keep moving forward. Point 6. Strength after 60 doesn't come from trying harder. It comes from smart consistency. After 60, the body responds very differently than it did at 30 or 40. When you're younger, train hard, muscles recover quickly. Take a short break, strength stays. But as we age, push too hard, muscles and joints go into defense mode. Rest too long, strength fades quickly. Research on aging physiology shows after 60, muscles respond best to light to moderate stimulation done frequently rather than intense workouts done occasionally. In other words, an aging body likes familiarity. It doesn't like being shocked. People who train like this, I'll do a lot when I feel motivated. I'm tired, so I'll rest for a few days. Often complain, I keep exercising, but I'm not getting stronger. Strength comes and goes. Motivation fades quickly. Meanwhile, people who do a little every day, keep a steady rhythm, don't wait for motivation, are the ones who maintain strength the longest, experience fewer aches, and feel less afraid of movement over time. After 60, think of movement like brushing your muscles' teeth. It doesn't need to be long, it doesn't need to be intense, but it must be consistent. All you need is a fixed time each day, familiar movements. The feeling that my muscles are working, not my muscles are suffering. When you do this, the brain learns something very important. This body is still being used every day. It needs to stay strong. At 60, I don't ask myself, how much did I work out today? I only ask, can I continue again tomorrow? If the answer is yes, then I know I'm on the right path. True strength at this age isn't about explosive effort. It's about being able to continue tomorrow and the day after. If you've listened this far, I want you to pause and ask yourself one simple question. What do I fear most about getting older? For many of my patients, the answer isn't illness. It's needing help to stand up, having to hold on to something while walking, carefully planning every step out of fear of falling. The truth is, independence doesn't disappear because of age. It disappears when your legs aren't strong enough, aren't stable enough, aren't confident enough to react. Today we covered the essentials. The body after 60 isn't weak because of age, but because it lacks the right signals. Walking is good, but not enough to keep you steady. Joints need to be taught how to bear load safely, not avoided. Balance is about reflexes, not just strength. Leg circulation determines whether you feel tired or confident. Smart consistency always beats bursts of effort. If you remember just one thing, remember this. Every day you choose to move on purpose, you are choosing your future. You don't have to do everything at once. You don't have to be perfect. You don't have to be like anyone else. Start with one small habit, one consistent time. The feeling that you're caring for your body, not forcing it, because the body is honest. It responds exactly to how you treat it. I'm David Warren. If you found this helpful, consider subscribing for more calm, science-based, practical guidance to help you. Keep your legs steady, keep your body flexible, and keep your life within your own control. This video is for educational purposes only and does not replace personalized medical advice. If you have medical conditions or health concerns, please consult your healthcare provider before applying any of these suggestions.